Welcome to NCLEX Map, the power engine that turns nursing knowledge into confident action. Today we're diving into H&H, hemoglobin and hematocrit. Let's start with hemoglobin. Hemoglobin is a protein in red blood cells that carries oxygen from the lungs to tissues. If hemoglobin is low, the body struggles to deliver enough oxygen. Critically low hemoglobin can lead to hypoxia and organ failure. In adults, normal hemoglobin ranges from 12 to 16 grams per deciliter for females and 13.5 to 17.5 for males. Lower hemoglobin means less oxygen carrying capacity, while higher means more red blood cells in circulation. Now let's talk about hematocrit. Hematocrit measures the percentage of blood volume made up of red blood cells. If a patient's hematocrit is 40%, that means 40% of their blood is red cells. For most adult females, hematocrit is around 36 to 46%, and for males, it's 41 to 53%. A handy rule of thumb, hematocrit is usually about 3 times the hemoglobin. This relationship helps identify lab errors and trends in blood loss. So what do these numbers really tell us? H&H reveals 3 key things. Can this blood deliver oxygen? Is there blood loss or hemodilution? And is the patient in a chronic low oxygen state? Let's look at some clinical scenarios. First, postpartum hemorrhage. A client 8 hours post-delivery feels dizzy and weak, with a hemoglobin of 8.2 and hematocrit of 25%. That's low. You'd expect closer to 12 and 36. This indicates blood volume loss and reduced oxygen carrying capacity. Nursing priorities? Assess actively, monitor vital signs, and anticipate interventions like fluid bolus or packed red blood cells if needed. Key point: a falling H&H after delivery is not just anemia. It signals potential ongoing blood loss. Next, consider a surgical patient day 1 post-op. His hemoglobin is 7.1 and hematocrit is 21, down from 13 and 39 pre-op. Is this an emergency? Assess how the patient is tolerating it. If he's stable, it might be expected post-op loss plus IV fluid dilution. Remember, large volumes of crystalloid fluid can dilute blood, making H&H appear lower. Action: assess the whole patient and trend the numbers. Now let's talk about dehydration. An older adult comes in with fever and vomiting, and his hemoglobin is 17 with a hematocrit of 55%. That looks high, but it's classic hemoconcentration due to dehydration. Thick blood can increase the risk for clots and poor perfusion. Nursing action: rehydrate, don't phlebotomize. Next, chronic anemia in a young adult. A 24-year-old feels tired, with a hemoglobin of 9.5 and hematocrit of 30. Is this acute or chronic? Look for signs of iron deficiency anemia and reinforce iron intake with diet and supplements. Chronic low H&H matters because it can lead to fatigue and dizziness. Now, let's discuss COPD and secondary polycythemia. A long-term smoker has a hemoglobin of 19 and hematocrit of 60. This isn't good. It's compensatory due to chronic low oxygen levels. Thick blood increases the workload on the heart and risk for clots. Your action? Monitor oxygen saturation and encourage hydration. Next, pregnancy and physiologic anemia. A healthy third trimester client has hemoglobin of 10.8 and hematocrit of 32. In pregnancy, plasma volume expands, leading to hemodilution. But don't label every low H&H as normal. Assess for symptoms and consider iron supplementation. Finally, symptomatic anemia that requires escalation. A patient's hemoglobin is 6.8 and hematocrit is 20, with signs of tissue hypoxia. This is significant anemia, and packed red blood cells will likely be ordered. Your job? Ensure updated type and screen, monitor vital signs, and prepare for transfusion. Remember, lab values tell a story. They don't exist in isolation. Key concepts. Low H&H means reduced oxygen delivery. High H&H can indicate dehydration or chronic hypoxia, and trends matter more than single numbers. When handing off, be clear about the patient's status and what the numbers mean. Final takeaways. Hemoglobin carries oxygen, hematocrit shows red cell percentage, and always treat the patient, not just the number. Thanks for learning with NCLEX-map. If this helped sharpen your clinical judgment, like, share, and subscribe for more high-yield bedside thinking.